Hi, I'm Dr. Margriet Barnard, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. Hi there, midwives. I have a special announcement just for you. The Sensitive Midwifery Academy is excited to announce that registration is now open for the 2025 Certified Sensitive Midwife course. This acclaimed certification course, successfully delivered 7 times before, continues to explore the sensitive midwife way, empowering you to fully understand and champion every woman's incredible ability to conceive, grow, birth, and raise a healthy baby. We've refined this unique approach through extensive experience and previous cohorts, teaching it to midwives who have all experienced significant positive transformations in their practice and careers. This comprehensive online masterclass was created by someone who truly understands what it's like to work in a demanding environment where traditional practices may clash with your values. As a digitally delivered class, you can enroll and participate from the comfort of your own home. We offer a step-by-step process that's easy to follow, ensuring no student is left behind. You'll receive all the support you need, making this course perfect whether you're in the public sector, private practice, or working independently. The Certified Sensitive Midwife course is delivered digitally over 5 months. If you want to get back in the driver's seat of your life by truly embodying the sensitive midwife way, or gain the training and support you need to excel in your career, and discover how to become a confident, independent practicing midwife today, then the Certified Sensitive Midwife course is for you. For more information and to register your spot for the course now, visit www.sensitivemidwiferyacademy.com/CSMC. In this episode, I'm talking to Sarah Jones, who is an independent midwife, and she runs her own practice called Great Expectations Midwives. Sarah Jones is specialized in doing home births, natural births, but she also has a special interest in doing VBACs, vaginal births after Caesars. So I will be talking with Sarah about everything in and around VBACs specifically. So many of our listeners and women out there are having questions about it and are considering VBACs. So this is an insightful and informative episode in and around this topic. If you're looking for a midwife to do your VBAC or your beautiful home birth in the Gauteng area, look out for Sarah Jones. Welcome back to another episode. We're here with Sarah again, and for the attentive listeners and watchers, you would have noticed that we've already done an interview with Sarah where she was bravely sharing her birth story, and she was sharing about her emergency cesarean section, expecting the unexpected. Today we want to talk with Sarah about VBACs, because they stand for vaginal birth after Caesars. Obviously, that might be something that Sarah wants to consider should she conceive again for herself. But she's also a very experienced VBAC midwife. She does a lot of VBACs. So she's an expert talking about it. In South Africa specifically, we get loads of mommies requesting VBACs. So yeah, it's a very relevant topic, right, Sarah?
Yes.
Thank you for wanting to talk about it with me. Let's just start off with your own thought about VBACs now that you've been through emergency Caesar.
I think, undecided if I would have another baby, but I think if I did fall pregnant, I don't think, I wouldn't think too hard. Like a VBAC would definitely be what I would attempt. I wouldn't foresee myself choosing to have a C-section electively. I do, from a midwife perspective, VBACs are very are safer, especially for those mommies who are really planning to have more than 2 children, because one of the biggest risks with having seizures after seizures is obviously the placental complications in the consequent pregnancies. So really, for those moms who are wanting to have big families, it's much safer for them to consider attempting a VBAC. And you know, as a midwife in South Africa, because our C-section rate, our primary C-section rate is so high, we really do get a lot of moms who request to have a VBAC because potentially they went, you know, down the gynae route, the typical gynae route, and maybe weren't given, you know, a great opportunity to have a vaginal birth to start off with. They really have a great success rate because they, you know, they didn't necessarily have a C-section for any physical reason, and therefore their VBAC success rate is really high.
That's interesting. Yeah, that's important to note. So in South Africa, especially in the private sector, we have a high elective Caesar, right? So just unpack that a little bit, the elective Caesar.
Yeah, I think you know, when you're dealing with I would say gynaes as a broad term, who aren't specifically natural birth supportive, I think that women go there and you get what we call the typical bait and switch, you know, where we kind of choose the gynae, and at 16 weeks, you know, will you allow me to have a natural birth? And it's yes, 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 until right at the end, when now we decide, no, now there's complications or reasons why they're not going to support you through the natural birth process. And then I think at that stage of pregnancy, it's so difficult for a mom to stand up for herself and say, well, no, actually we're gonna sit this out. You know, when a medical professional is telling you that something's wrong with you or the baby, you're not really going to question that. So then they do land up, you know, having elective seizures for whatever the reason is, and maybe that it wasn't necessary. But I think if you are going to stand up to the gynae, it takes a lot, and you really got to have your ways about you if you do pull that through. You know, I think the moms who pull off a natural birth in a hospital setting with a gynae are heroes.
They really are. Yeah, so it's important for first-time mummies especially to be aware of this this issue that we're facing. It's not a secret. It's out there. We know that we have a 78% cesarean section rate in the private sector, which is absolutely abnormal. The World Health Organization still says 10 to 15% is a justifiable rate. And yeah, so that is something that is a real threat. If you want to have a natural birth and you go the doctor route, then you almost have to become an activist to fight for a natural birth. So, but oftentimes we find that it's too late, and that women go because their sisters, their moms, they've gone gynae route, that they're in that environment. They've got medical aids that support gynaes well and hospitals well, maybe not so much midwives. That is another battle to fight. But and then they've gone through all of these experiences, and when they process their birth, they realize a few things. And that is often when they land with people like you, right, and me. But you specifically, you're really quite active and happy to help women with VBACs. So tell us a bit more about that, how that it looks for you, how you help these women.
I think, so I mean, one of the things is that I generally, I don't really treat my VBAC moms overly different to how I would treat a normal first-time mom who's presenting to me, especially if their C-section was elective prior to labor, because it's the first time that they're going to labor. It's, you know, we really got to give them the best option that we can. And you know, when we look at risks that everyone sort of will throw out at you, you know, the gynaes will talk about a uterine rupture, which is one of your risks if you attempt a VBAC. You're looking at about a 0.5 to 1% chance of a uterine rupture rate. And I think the important aspect to look at is, of those people who have a uterine rupture, the mortality rate from that is exceptionally low. So you're still looking at, like, I think it was 0.0038% of people who then die from a uterine rupture. So, you know, I always tell moms to always look at the flip side of that in terms of you've got a 99% chance of not having a uterine rupture and actually having a successful, you know, and not leading with that complication. And then I think what's really important for those moms is to make sure that you choose your care provider because you really want to, like with everything, you really want to be with someone who sees that on not necessarily a daily basis, because I don't do births daily, but someone who sees it often, you know, so someone who does natural or, you know, physiological birth all the time, because if you see it often, you'll know when something's not right, and when you need to intervene, and when you can kind of sit back and allow the labor to unfold on its own. Whereas if you don't see natural or physiological birth often, it can be a frightening experience for someone who's never done that before, especially on a previous Caesar, because in the back of their mind they're always considering the uterine rupture. And I think you might find that they will rush the birth, and therefore you land up with a lot of interventions, and then we land up with the cascade of interventions and eventually the C-section. But so I think that's really important, to choose your care provider well.
So someone that's used to natural physiological birthing and know what it looks like. That's important. So midwives are really good candidates for that.
And then I think, you know, the other thing to be aware of is, I mean, what I see it as quite a blessing, is that when you're attempting a VBAC, there's really very little that we can do from an intervention perspective. So we can't give you any medication to bring on contractions or to make the contractions stronger than what they are. And therefore, which is why I enjoy them, is we've really got to just trust the body and trust the process. But obviously the downside of that is that if you do land up kind of going far overdue, or we do land up with a very extended labor that's not progressing, then, you know, we do have to consider a repeat C-section, because we can't do the medication route for induction or augmentation or anything like that.
You need to be very in tune with your body, feel what's going on. That's why we can't intervene with this process. It's even more important now. So that's a very important fact to know. You need to be prepared for a beautiful natural birth. No epidurals. You've got to feel your body. So Sarah, I know in South Africa we're not allowed to do a VBAC outside of a hospital setting. That's sort of what the new guidelines are saying, for safety reasons. And which is totally understandable if you look at the total picture of our country. If a woman is far in a rural area, you just want to have emergency help there when you really need it. You don't want to have delays. So we understand that. How does it look for you as a midwife that is very hands-on doing VBACs? Do you always do them in a hospital or?
So I mean, not necessarily a hospital, but a facility that's got access to theatre. So it's quite important that. And again, like you said, it's because we want access to help rather sooner than later. Because obviously, if we are sort of attempting a VBAC in a home setting, and we do pick up that we need assistance, you've got the drive into the facility and then the process in the facility of having someone admitted. I think in countries where that backup process is much smoother, then you could consider something like that, you know. But in South Africa, the reality of the situation is that moving from home into a hospital brings its own delays. So we got to take that into account. So it's really important that when we make the decision to go to theatre, that we're not looking at an extended wait before that the help is achieved.
That is key. It's like emergency available, intervention available on time, and have your team ready. So you work together with a doctor, obviously. They also clear your VBACs. So those are important aspects. So that makes it, I think, in South Africa, for many women, impossible to have a VBAC, because not everyone has the luxury that you have.
Yeah, I think it's a financial thing because you've got to pay a lot of medical aids don't cover the midwives well. So, a lot of women then, they're nervous to bring on a midwife in case that they then, do land up with a C-section, because now you're in for the cost of the midwife plus the gynae. But I think you've got to weigh that cost up in terms of, the chance of you having a successful VBAC with a midwife is way higher than going the gynae route. So, in my opinion, the cost is worth it.
That's so true that you say, because if a gynae got you a Caesar in the first place, when you were all healthy, what's the chance that he will get you a natural birth for a VBAC? So that's very important to consider. Yes. But yet you have done a lot, and you've got lots of good success stories.
Yes, yeah. I mean, I think if I worked through my stats last year is probably not a great idea because I had a baby, so I was off for a couple of months. But I think like a good third of my practice was moms attempting a VBAC, and we had about a 75% success rate. So it is good, I do believe that if we leave the moms to do what they're going to do, then they do have a successful VBAC.
That's amazing. That's incredible stat.
When you start intervening, that you look at complications.
Yes.
Yeah.
So that is wonderful. The reward must be extreme.
It is, yeah. I think that's why I enjoy VBAC so much, is because the moms are very they're very keen and they're very committed to the process, because like myself, I've been through an emergency C-section and I don't necessarily want to do that again. So you're very committed to doing everything you can to try and have a natural birth. So the moms are, and if you're committed, then normally you do reap the success of it. So that's why I enjoy it. And obviously I enjoy it because we can't do any interventions, you know, so I have to kind of just sit back and allow that. And then I think that's why it's so rewarding for the mom, because she knows that she did that on her own. She wasn't, she wasn't given any medication to have that happen. She did all the work.
So on that note, any tips for moms on what they can do to have a successful VBAC?
I think obviously, again, emotional prep. Obviously you must prepare for the possibility of another C-section. And I think because they've been through the C-section before, it's probably a bit easier for them to emotionally prepare for the possibility of the C-section. And then physically, your general stuff in terms of exercises and stretches and things to do. Like when I was pregnant, I used to do exercises and that sort of on every night, just to try and help the ligaments and all of that to be at their optimal. And then again, to choose your provider well. And if you don't choose a midwife and you do go the gynae route, just make sure you ask them up front, what their policies are, what their guidelines are, what they do allow, what they don't allow, especially in terms of how long you're going to labor, what monitoring they're going to use in labor, and how long they'll let you go in the pregnancy are really important factors to consider. And then if you do choose them, to make sure that you're okay with that, because that is what those are the restrictions they will put on you. And if you're not okay with that, to change your plan.
Yes, that's very good tips and things to consider. I'm just thinking of the mummies that had Caesars in the government sector. In your experience, do they get VBACs in the government sector?
I think it depends on the facility. So I think you probably find the tertiary government hospitals would potentially allow them to have VBACs. But I don't think in the sort of secondary or primary facilities that they'll allow that. Again, mainly because of access to emergency care. And I think that's one of the main reasons, and I think when you go with a private midwife, you one-on-one care. So I'm with my clients all the time. once she's in active labor, like monitoring her all the time. Whereas in a government facility, when you sort of one midwife dealing with 4 or 5 clients that are birthing, it's hard for you to monitor them the way they need to. So I think it's probably a logistical issue more than anything else.
I think, yeah, that is the issue, correct. Yes, because you do need that special monitoring.
Yeah.
Because there is that risk that you want to pick up rather sooner than later.
Yes.
Should there be something wrong.
And it's important to be with them. You know, we can put on all the monitors we like, but unless you're sitting with the woman, you don't really know what's going on. You know, the machine can beep, but if you're busy with 5 other births, you know, how you gonna manage that? So I think then by the time the midwife gets there and it's too late, it looks, you know, makes the process a bit daunting.
Exactly. Ideally, we have one-on-one midwife woman care for every woman. Hey?
Yeah, if only.
If only that were possible. We need a lot more investment in midwifery.
Yes.
And I think doulas can also play a role there in that space.
Yeah, and definitely experienced VBAC doulas, you know, they also know sort of what to look out for. Just as long as you've got someone with that woman who knows, you know, what to ask her, you know, do you have pain in between contractions, that sort of thing, which is really important, so that she could then, you know, relay it to the midwife, so that then maybe you don't miss it. I mean, all my VBAC moms must get doulas because it helps that just the extra support for the mom.
Yeah, that's a good point. Sarah, thank you so much, and for all the work you do, amazing work. It takes a special midwife to, especially also in a context where VBACs are maybe not always so welcomed. In certain countries it's quite the norm. So you must have grown some thick skin here and there, but it also grows confidence.
And I mean, I think you just, you know, you got to just keep at it, you know. And I think when you see, you know, the more you do them, the more confident you get in doing them. And realizing that it's actually just another birth, you know. You just got to consider a few other things in the process, but it's just another natural birth that you've got to monitor someone through, and they stay safe. I think, like we say, the stats are there, and you just got to believe in the process.
Exactly. Well, this was very insightful. I'm sure many women can relate or are curious for this kind of information. So thank you for sharing your wisdom with us.
Pleasure.
And share it with whoever you think needs to hear this message of Sarah. And thank you for tuning in, and we'll see you next time. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.